How does personality impact risk-taking? Cooper et al. Sought to find this mechanism by measuring how personality impacted risky behaviors according to drinking and risky sex. The study found that personality did impact risky behavior, but is mediated by needs or motive variable. The subjects were asked questions to determine their personality, motives, impulsivity, and use behaviors. Personalities are split along neuroticism and extroversion. Neurotic individuals are defined as people who are hypersensitive to criticism, self-doubt, alienation, and tend to dwell on the negative. Extroverted individuals, on the other hand, tend to have high levels of activity and are assertive, confident, and social. Impulsivity is the tendency to enter situations without planning or consideration of negative consequences. The study found that personality affected behavior through distinct needs pathways. For instance, neurotic individuals had coping motives and thus engaged in risky behavior to control mood states. Extroverted individuals had enhancement motives and engaged in risk to enhance positive experience. Personality constructs accounted for 32% of the variance in alcohol use, and impulsivity combined with personality predicted motives. In a broader study by Zuckerman and Coleman, which investigated risk-taking in 6 domains, personality was again found to be predictive of risk-taking. Moreover, genetics is an important underlying factor that contributes to personality. In the Zuckerman and Coleman study, risk-taking was measured by use behavior in smoking, drinking, drugs, sex, driving, and gambling, and compared against impulsive sensation-seeking, aggression, sociability, and neuroticism and anxiety. Sensation-seeking is defined as the seeking of varied novel sensations and willingness to take on physical, social, or legal risks for experience. The most predictive of these risk behaviors included impulsive sensation-seeking, aggression, and sociability. These were all positively correlated, which meant that if an individual had a high tendency to be impulsive sensation-seeking, aggressive, and social, they were more likely to engage in risky behaviors. Neuroticism was not significant, which supports our previous discussion that neuroticism is mediated by motive and impulsiveness. More importantly, personality traits associated with risk-taking have moderate heritability. Twins, for instance, are likely to have similar levels of sensation-seeking and extroversion. In particular, monoamine oxidase enzyme, or MAO, is negatively correlated with risky behavior and is genetically heritable. MAO is an enzyme or protein that breaks down neurotransmitters, particles that help neurons communicate. MAO specifically impacts the regulation of the neurotransmitter dopamine, which is heavily involved in risk-taking behavior. Thus, higher dopamine levels due to the absence of MAO can lead to more risk-taking and is oftentimes associated with tobacco, drug use, criminal offense, bipolar disorders, ADHD, antisocial personality disorders, and borderline personality disorders. In support of our discussion on age, MAO levels are low in adolescence and increases with age. And in regards to gender, MAO levels are higher in women compared to men, leading to more risk-taking behaviors in men.